My name is Jeff Meyers. I'm a general neurologist with Prisma Health. I attended Loma Linda University, which is a university inland from Los Angeles in Southern California. And there's where I developed my interest for neurology. I got an opportunity midway to work with a neurologist who turned out to be my mentor, filming patients and learning about their different disease processes and what those would look like, and seemed to really enjoy the diseases that I saw, the types of patients that I saw. I had a lot of interest in the science of neurology. I did my general neurology training at Prisma Health Midlands. Spent 4 years learning about the science and the diseases of neurology. I like to think of neurology, it's the science of the brain and then the nerves. Those are kind of the two big pieces. And so dealing with the diseases and the different dysfunctions of those organs, both the brain and the nerves. So I picked neurology about midway through my medical school training and had a really good experience with a mentor of mine, as well as some of his patients that he saw. I really enjoyed the way that he interacted with his patients, spending time learning about them and the different problems they were experiencing, and being able to find ways to help better their lives. So I like to spend a lot of time educating my patients. Part of that task is to learn a bit about the patient. It's important to understand where a person's coming from and what their experiences have been, what things they know and don't know already. I think that's an important way to establish. And I like to spend time teaching about the brain, teaching about whatever diseases that we may come across. Part of the treatment of neurologic diseases is certainly medications, and we spend a lot of time doing testing, images, labs, and different things. But a big part of a lot of neurologic diseases is learning about lifestyle, learning about different behaviors, diet, exercise, stress management, a lot of different things that go into the different neurologic diseases that I think are as important, if not more important, than many of our medications, depending on what disease that we're treating. I'd like to spend a lot of time learning and teaching about those things. I think we're going to get a lot of yield by people implementing those things in their lives. Outside of neurology, I have 2 kids. Much of my time is spent with them. So my 2 kids and my wife. And then we have 2 pets, a cat and a dog at home. So much of our time is spent with doing home things and helping better my kids, teach and whatever their interests are. They have a lot of things that they're enjoying doing right now. If you're interested in an appointment with our office or with myself, best way to get us is to speak with your primary care doctor and have them make a referral. If you have any questions, you can call our office.